guys, and welcome to How to Gastro. In today's video, we're going to be talking about a very interesting and common childhood pathology, and that is Roseola infantum. So let's get started. So what is Roseola infantum? Roseola infantum is a viral illness that most commonly affects young kids between the ages of 6 months and 2 years old, but adults may be infected too. The causative pathogenic agent in this infection is usually by the human herpes virus 6, which is commonly known as HHV6, and less frequently by the human herpes virus 7, which is also commonly known as HHV7. The infection is also known as 6 disease, exanthum subitum, and just plain old roseola. And the disease is usually marked by several days of high fever, followed by a distinctive rash, which occurs just as the fever breaks. So from this definition of Roseola infantum, we get that it's actually a viral illness that most commonly affects children under the age of 2, and more specifically kids aged between 6 months and 2 years old. So the disease is actually caused by the specific viral agents called herpes virus 6 and less commonly herpes virus 7. And this is actually what the structure of these viral particles look like. So we have the HHV6 and then the HHV7. So the characteristic manifestation of this disease is this markedly high fever for several days, and then as the fever drops, we have this sudden appearance of this distinctive rash, which is usually found on the neck, the trunk, and the thighs of this child. So now that we know what the basics of Roseola infantum is, let's take a closer look at how one can contract this disease. So roseola is highly contagious, and the infection spreads when a child who's infected with roseola talks, sneezes, or coughs, sending tiny viral droplets into the air that others can breathe in. The droplets can also land on surfaces, and if other children touch those surfaces and then touch their nose or their mouth, they can become infected. So as we can see in this little video playing at the bottom of my screen, the disease actually spreads in a very easy way. So when an infected individual talks, sneezes, or coughs, these viral particles are sent into the air and then can be easily breathed in by someone who is uninfected, and thereby infecting them. So in addition to these viral particles having the possibility of being breathed in by another individual, they can also actually land on multiple surfaces, such as toys in a kindergarten, for example. And when another child comes into contact with this toy, which has contaminated viral particles on it, and then uses the same hands to touch their face or their nose or their mouth, they can also become infected in this way. So as we can see, the disease is actually highly contagious and spreads very quickly and easily. The signs and symptoms. So as we mentioned in the first slide, the disease initially presents with a fever, and roseola typically starts with a sudden high fever, which is often greater than 103 degrees Fahrenheit, which is around 39.4 degrees Celsius. And these children will also suffer from a sore throat, a runny nose, a cough, swollen lymph nodes in his or her neck, and of course we will have this appearance of the rash. So once the fever subsides, which takes around 5 days, the rash will appear, and the rash consists of many pink spots or patches, which are generally flat, but some of them may be raised. The rash usually starts on the chest, back, and the abdomen, and then spreads to the neck and the arms. It is usually very itchy and uncomfortable and may last from several hours to several days before fading. So as we can see, in addition to that fever, sore throat, runny nose, cough, and some swollen lymph nodes, we have this appearance of this rash, which is usually after the 5 days of a heavy fever. So the rash typically presents as these tiny pink spots or patches, and they are generally flat, but some of them can be raised, and it's usually very itchy and uncomfortable for these patients. And the rash can be commonly located on the chest, back, and the abdomen of these patients. So now let's talk about the diagnosis of Roseola infantum. So classic Roseola infantum is a clinically based diagnosis, and this means that the history of a high fever, which lasted approximately 3 to 5 days, and then the appearance of the small rose pink or red 2 mm to 5 mm papules and macules on the neck, trunk, and thighs is essential for the diagnosis. So this means that usually, based on the patient's history of the disease and the classic fever, as well as the classic rash, we can actually put a diagnosis of ROSEOLA infantum. So laboratory tests are unlikely to be necessary for the evaluation of ROSEOLA, but are sometimes drawn during the febrile phase of the illness to rule out other diagnoses. And this is carried out by drawing out a blood sample and then sending it to a laboratory to test and check for specific antibodies for ROSEOLA. So sometimes, if we have a suspicion of another viral infection, such as measles or something similar, we can actually confirm this diagnosis by taking a blood sample from these patients and then sending it for lab testing to look for the antibody specific for ROSEOLA. And this is how we can confirm the diagnosis of the disease. And finally, let's talk about the treatment of ROSEOLA infantum. So there's no specific treatment for ROSEOLA infantum. The majority of cases of ROSEOLA are mild and self-limited. Treatment is purely supportive with rest, maintaining good fluid intake, and some antipyretic drugs such as acetaminophen or ibuprofen to control the fever. And that brings us to the end of this video on ROSEOLA. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share. And please make sure you turn on your bell notifications so you'll be notified every time we have a new upload. If you'd like to download a copy of this presentation, you may do so by clicking the link in the description. Take care and bye for now.